Welcome. This is the 7th video looking at the spread of the COVID-19 virus. The topic of this video is herd immunity. In the 1930s, research was published in the United States on the spread of measles in Baltimore, where it was noted that some children had become immune to measles. The number of new infections temporarily decreased, including to children who would otherwise have been susceptible. Despite efforts to replicate the circumstances, it failed, until a measles vaccine was developed in the 1960s, and mass vaccination all but eradicated measles. When a large percentage of the population become immune to a disease, the spread of that disease slows down. Many viral and bacterial infections spread from person to person. This chain is broken when most people don't get or transmit the infection. This helps protect people who aren't vaccinated or who have low functional immune systems and may develop an infection more easily, such as older adults, babies, young children, pregnant women, people with a weakened immune system, and people with certain health conditions. For some diseases, herd immunity can go into effect when 40% of the people in a population become immune to disease, such as through vaccination. But in most cases, 80 to 95% of the population must be immune to the disease to stop its spread. For example, 19 out of every 20 people must have the measles vaccination for herd immunity to go into effect and stop the disease. This means that if a child gets measles, everyone else in this population around them most likely have been vaccinated, already have formed antibodies and be immune to the disease to prevent it from spreading further. The goal of herd immunity is to prevent others from catching or spreading an infectious disease like measles. However, if there are more unvaccinated people around the child with measles, the disease could spread more easily because there's no herd immunity. The percentage of people that must have immunity to safely slow or stop an infectious disease is called the herd immunity threshold. Social distancing and frequent hand washing are currently the only way to help prevent you and those around you from contracting and potentially spreading the virus that causes COVID-19. There are several reasons why herd immunity isn't the answer to stopping the spread of this new virus. There isn't yet a vaccine. Vaccinations are the safest way to practice herd immunity in population. The research for antivirals and other medications to treat COVID-19 is ongoing. Scientists don't know if you can contract COVID-19 more than once. People who contract and develop COVID-19 can experience serious side effects, and severe cases can lead to death. Doctors don't yet know exactly why some people who contract COVID-19 while others do not. Vulnerable members of society, such as older adults and people with some chronic health conditions, can get very sick if they're exposed to this virus. Otherwise, healthy young people may become very ill with COVID-19. Hospitals and healthcare systems may be overwhelmed if many people develop COVID-19 at the same time. Herd immunity is community or group protection that happens when a critical number of the population is immune to a certain disease. It can help stop or slow the spread of an infectious disease like the measles or COVID-19. The safest way to get immunity is through vaccination. You can also get natural immunity by contracting illness or building an immune response to it. Herd immunity isn't the answer to stopping the spread of COVID-19. Once a vaccine is developed for this virus, establishing herd immunity is one way to help protect people in the community who are vulnerable or have low functional immune systems. There has been one expert analysis published that found that creating herd immunity in the UK would require more than 47 million people to be infected, with a 2.3 fatality rate and a 19% rate of severe disease. This could result in more than 1 million people dying and a further 8 million needing critical care. Let's just say Australia and New Zealand relied on herd immunity. Now let's assume that 10% of the population were infected. That's 500,000 New Zealanders or 2.5 million Australians. Over a short period, these numbers would disastrously overwhelm our health systems. The Australian government this week released the COVID-19 modelling that they have based their response on. Modelling for COVID-19 involves making assumptions about how the virus behaves. Early in the awareness of the virus, the Australian government started to prepare using data from China and other countries to gain an understanding of how this virus behaved within populations. The initial modelling shows a scenario of an uncontrolled outbreak. In that scenario, peak daily intensive care unit ICU beds demand is 35,000, which would greatly exceed Australia's expanded capacity of 7,000 ICU beds. With isolation and quarantine, demand is reduced to 17,000 ICU beds at its peak, still well above the expanded capacity. With isolation, quarantine and social isolation, daily demand is reduced to below 5,000. The tougher the restrictions, the bigger the impact, but the longer the outbreak continues. Modelling is a useful tool, but it does not predict the future. In the real world, restrictions can be adjusted as the outbreak evolves to manage the length of the outbreak. The longer the outbreak continues, the greater the economic impact to the economies of the countries. There are no medicines or vaccines for COVID-19 at this time. We must rely on public health interventions to control the disease. These fall into 6 areas: identifying cases, isolating cases, tracing and quarantining contacts of cases, improving hygiene, restricting travel and social distancing. The modelling released by the Australian government summarises 4 scenarios. Scenario 1, the theoretical modelling finds an uncontrolled COVID-19 pandemic scenario would overwhelm our health system for many weeks and infect around 89% of the population, with 38% requiring some medical care. Intensive care units would be stretched for a prolonged period of time beyond capacity. Basically, our healthcare system would collapse. Only 15% of people requiring ICU beds would be able to access one, even with the expanded ICU capacity in the government model. The second scenario, quarantine and isolations do slow the rate of transmission. This flattens the curve. It reduces the proportion of people who would catch the virus to 68%, and those needing medical care to 29%. While this reduces the peak demand on ICUs, the model's expanded ICU capacity would not be enough for several weeks. Only an estimated 30% of people requiring ICU beds will be able to access them. In the third scenario, social distancing makes it harder for the virus to spread and reduces the proportion of people infected. The model looks at 2 levels of social distancing, with a 25% reduction in its transmission due to social distancing. The proportion of people infected would be 38%, with 16% requiring some medical care. 80% of people who need ICU beds could access them. With a 33% reduction in transmission due to social distancing, the proportion of people infected is 12%, and only 5% require some medical care. Everyone who needs an ICU bed over the course of the pandemic could access one. The current preventative measures implemented by the Australian government and the states and territories have largely been successful in flattening the curve. The Australian model finds our intensive care units. Our health system will cope if we continue to have an effective social distancing policy. We also need to increase our health system capacity and isolate people with the virus and their close contacts. The pandemic virus may seem rather distant for most of us in Australia, but it's very real for individuals on the front line who daily place themselves in harm's way to ensure our way of life. The individual lying in hospital struggling for breath, separated from family and loved ones. The family at home separated from their loved ones in hospital. Unfortunately, not everyone survives, and this is especially painful for the families left behind who are unable to say goodbye or give the deceased the funeral they want in the current restrictions. So next time you think about going out, consider others. It can be you or a loved one lying in hospital fighting for breath. There is no approved treatment for COVID-19 virus, and the only way to achieve herd immunity is via the development of a vaccine and inoculation of the whole global population. Across the world, trials are underway and have progressed at a remarkable pace. It is estimated that clinical human trials will begin sometimes in June at the earliest. This is to ensure the safety of the vaccine and the potency prior to going into mass production. The earliest a vaccine will be available is more likely 2021. We've discussed previously the criticality of flattening the curve as part of the Australian Government and state and territories' COVID-19 strategy, and to date we are succeeding. Some states have found this challenging, but the outlook is promising. Collectively, we must continue to do the following. Keep your distance. One way to slow the spread of the virus, such as COVID-19, is social distancing, also called physical distancing. The more space between you and others, the harder it is for the virus to spread. In public, practice social distancing. Stay at home and only go out if it's absolutely essential. Keep 1.5 metres away from others. Avoid physical greetings such as a handshake, hug or a kiss. Use tap and go instead of cash. Travel at quiet times and avoid crowds. Avoid public gatherings and at-risk groups like older people. And practice good hygiene. Households. All Australians are required to stay at home unless it is absolutely necessary to go outside. Australians are permitted to leave home for essentials such as shopping for food, exercising in a public space as a park, limited to no more than 2 people. Going out for a medical appointment or to the pharmacy, providing care or support to another person in a place other than your home, going to work if you cannot work from home. Australians should work from home where they can. Letting the virus rip through the Australian population result in the collapse of the health system and a tenfold increase in the mortality rate, especially to the vulnerable and the elderly. Implementing limited measures will shorten the duration, but still result in the collapse of the health system. The only viable course is the current course, but we need everyone to follow the guidance. The current projections demonstrate that Australians are on the right track. Finally, unfortunately, those that we need the most during this event are the most at risk. We can't have failed to have heard news of the hundreds of medical providers, doctors, nurses, hospital workers, paramedics who have contracted this virus and passed away. But it's not just the frontline health workers who are at an increased risk. It's the elderly care assistants, it's the truck driver, and everyone who endeavours to ensure that we are cared for within our communities with the provision of food. Please think before venturing outside.